tests come in. As mentioned earlier, our differential changes as we move through the assessment. So the art of refining and updating our differential requires us to apply tests to the case. Now, often we think of tests as things that we order, like labs or diagnostic imaging. But in fact, a test is anything that we apply to that case. It includes all of the history questions that we ask, all the physical exam maneuvers that we do. And in fact, some conditions are diagnosed with the history and physical exam alone. Then we need to be able to synthesize the results of all these tests that leads us to the most likely explanation for the patient's condition. More on diagnostic test concepts in the next lesson. This leads me to my next point. So just because a condition pops onto your initial differential diagnosis doesn't mean you have to test it. Whether we test for a condition depends on multiple factors: how common the condition is, how dangerous the condition is, in other words, how bad it would be to miss it, whether we have another diagnosis that's more likely. So we have to prioritize our testing by going through the most likely possibilities, the red flag conditions, and only really need to move on to the less likely conditions if we don't have enough data to back up the former. On TV, those great medical providers often uncover rare diseases that us mere mortals would have missed. But honestly, the greatest task that we face day to day in practice is differentiating between common conditions that present similarly in medicine. We also have to remember that a diagnosis is not absolute. It's our best estimate of what's going on with our patient at any given time. So labeling a patient with a disease or a syndrome means that there's enough signs, symptoms, and other evidence to back that diagnosis up. But what we're really giving our patient is our best estimate of the most likely condition at that time. Sometimes signs and symptoms won't be evident, but they'll come up later on in that disease trajectory. Or, back to Hickham's dictum, the patient may in fact have multiple conditions accounting for their symptoms. To cement all these concepts, let's run through a case.